Hi, Karen Damshin with Damshin Financial Planning. Here with your weekly. Today it's going to be a Medicare and a health insurance update. So I wanted to talk briefly about something that I get a lot of questions about on a regular basis, and that is, what's a concierge doctor? So right here in Tucson, where I'm based, we have a number of doctors who have shifted their practice into what's called concierge medicine. So in a traditional, say, primary care physician's office, the way that typically works is on what's called a fee-for-service model, meaning you go to the doctor, they perform a test or an analysis for you, there's a billing code, and then your insurance is billed according to those billing codes. So that is fee-for-service. And the way that concierge medicine really differs from that is that a concierge practitioner is typically a doctor that you're going to pay a monthly or an annual fee to. And that is going to hopefully, ideally, give you access to that doctor in a way that you may not have had access to a traditional primary care physician. So concierge doctors typically say that they have smaller patient panels, so they have more time to spend with each patient. Sometimes your concierge fee may include some extra services, like potentially some very specific lab work or tests that doctor may agree is part of your annual contract. But often those concierge doctors are still billing your insurance company when you go in to see them. So perhaps you come down with a fever and you want to go see your doctor. Well, often a concierge doctor will guarantee that they can get you in the same day or the next day. As a matter of fact, there are some concierge doctors across the country that may even make house calls. I don't know that we have anybody in Tucson who's doing that. So with this concierge model, you have the ability potentially to have better access to a doctor, maybe get in to see them a little bit faster. And although you're paying a premium fee, you might have access to some tests or scans or whatever they may include with that. There's a second type of doctor called a direct primary care physician that is similar but a little bit different to a concierge doctor. So often direct primary care doctors will not take any insurance. They are direct to the consumer, meaning you pay a monthly fee, which is typically lower than what you may be paying a concierge doctor, but you pay a monthly fee to have that direct primary care doctor. These are typically doctors, nurse practitioners, physician's assistants who can order the same tests and perform diagnoses just like a traditional primary care doctor. But they may be doing it strictly for that monthly fee that you pay. Now, sometimes there can be additional costs like lab work fees or scan fees, those kinds of things, especially if a direct primary care doctor refers you out. But oftentimes they can refer you out and you can still use your insurance for those types of things. So two kind of different ways of getting access to a doctor that may be different than that traditional primary care model. So if you've ever had any questions about a concierge doctor, or you were with a doctor that maybe transitioned their practice, or you've had some experience with a direct primary care physician in town that you really like, I would love to hear about it. You can hit reply on this email and just let me know what your experiences are as we continue to see this face of healthcare changing as everybody tries to figure out what is the best way to get people the best health care. That being said, I hope you have a fantastic and healthy rest of your week. I'll see you next week.